Exposure to sunlight is natural, isn't it? It gives us a lot of benefits, including essential nutrients and vitamins. Regarding vitamins, it provides us with vitamin D3, which goes with conversion into D2, functioning like vitamin D. Another name for vitamin D2 is 25 hydroxy vitamin D. Let's have a brief study about it. 25 hydroxy vitamin D test is used to measure the levels of vitamin D in the body. Vitamin D is an essential nutrient that helps the body to absorb calcium and promotes bone health with many other essential roles. It should be present in between 20 and 40 nanogram per milliliter. Low levels of vitamin D may cause bone weakness and increased risk of fractures, inducing osteoporosis and osteomalacia, while high levels of vitamin D result in hypervitaminosis, which leads to increased concentration of calcium levels in body, causing kidney stones. In its procedure, we have to add few drops of blood on microplate of a specific vitamin D test kit with the addition of a buffer which give us the results in the given form. The immunoassay principle of vitamin 25 hydroxy OH test involves the use of specific antibodies to detect and measure the levels of 25 hydroxy vitamin D in a blood sample of a patient. The immunoassay technique is also known as competitive binding assay, which involves the use of primary and secondary antibodies. The primary antibody is specific to the 25 hydroxy vitamin D form and is bound to a solid spot such as microplate, while secondary antibody is labeled with a detection molecule such as an enzyme or fluorescent dye. When the patient's blood sample is added to the microplate, any 25 hydroxy vitamin D present in the sample will compete with the known amount of labeled 25 hydroxy vitamin D for binding to the primary antibody. The amount of labeled 25 hydroxy vitamin D that binds to the primary antibody has an inverse relation with the amount of 25 hydroxy vitamin D present in the patient's blood sample. That's how, with this particular test, many disorders related to bones and vitamin D status are diagnosed.